Hey everyone, in this lecture we'll be discussing anatomical terminology. Anatomical terminology should be one of the easiest lectures in this course, but it's also one of the most important. This is because accurate use of anatomical terminology provides consistency in communication. So why do we need consistency when talking about anatomy? This is because communication is critical, especially in medicine. Accurately talking about the body can literally mean the difference between life and death for some patients. Studying terminology is also important because our bodies can be described in three dimensions, so simply saying up, down, left, and right doesn't provide enough information. So, on a final note, the illustration on this slide shows what is called the anatomical position. In it, the subject faces forward with palms outwardly rotated. Dividing the body into planes simplifies the three-dimensional body into two dimensions, as we can see from this image. By cutting the body in half, from the nose to the back of the head, we get a sagittal section. Cutting from the front of the belly to the back, we get a transverse section. Cutting sideways from ear to ear, we get a frontal section. There are a few terms that we use to describe these planes. Anterior refers to the front. Posterior refers to the back. When discussing the head and neck, caudal refers to the back and rostral refers to the front. Medial and lateral are terms which are used in reference to a midline or central point. This midline is usually a sagittal plane, which bisects the body into equal halves. Lateral means farther from the midline. Medial refers to closer to the midline. Similarly, proximal and distal are terms which are used in reference to a central point. However, this reference point tends to differ in terms of which body part is being discussed. Proximal means closest to the body, whereas distal means farthest from the body. So in terms of movement, flexion and extension refer to movement at the neutral joints of the body. So in general, flexion decreases the angle of a joint and extension increases the angle of a joint. Flexing at the knees moves the leg upwards towards the thighs. Extending at the knees moves the legs downwards away from the body. Note how the same principles of flexion and extension apply to the arm, vertebral column, and head, as shown in this image. In figure E, we see some special movements which are unique to the arm. These include abduction, adduction, and circumduction. Abduction moves the arm away from the body. Adduction moves the arm closer to the body, and circumduction is the act of flipping the arm over. In figure F, we see that the legs can rotate in a similar manner. Inward and outward rotation of the legs is called medial and lateral rotation. So specifically to the forearms and hands, a prone position refers to the palms facing downwards. A supine position refers to the arms facing upwards. Specific to the feet, dorsiflexion moves the foot in the upward direction, and plantar flexion moves the foot downwards. Inversion is the act of turning the foot such that the heels face inward. Eversion is the act of pointing the heels outward. So for the jaw, retraction moves the jaw backwards and protraction moves the jaw forwards. Finally, opposition simply means opposing one body part against another. As shown in this example in image L, opposition can refer to opposing the thumb against one of the other fingers of the hand. The body consists of 7 main types of muscles, as shown in this diagram. These include circular, convergent, unipennate, parallel, bipennate, parallel fusiform, and multipennate. These are all named after the number of bellies that the muscle contains, as well as how the muscle runs its course in the body. So understanding these 7 types of muscle groups is useful in predicting what would happen in a clinical scenario when muscle function is lost.